Hi, I'm Dr. Jim Carlson from the Grove Animal Hospital and the Holistic Center. I'm going to be discussing case number 00167. And you probably received your copy of the sensitivity report and also the base point readings. Should have already started the hemp oil infusion, which I'll discuss how that works. You should have started also the herbal damp heat skin, which the herbal is designed to treat the pattern of heat and dampness. And then also we're updating the symptoms and recovery process. So unfortunately with skin disease, this is a lengthy process because it took them a while to get there. It's going to take them a while to feel better. And so we rate their comfort zone. We want to make sure that they're comfortable in the short term. So we may have to consider more traditional therapies. Unfortunately, when medicines, we've been on antibiotics, we've been on prednisone, we've been on pain relievers, and when that's not working, it's a condition known as atopic dermatitis, which is much more genetic related in a traditional sense, and often we don't see the results with traditional therapies. So if we need to create a better comfort zone, then I can refer you to a specialist to consider doing two medications. One is Apoquel, which works better for atopic dermatitis, and also the CAD injection, which can also work better with atopic dermatitis in those patients that may be reluctant to take medications. The goal is to not use it long term, but to use it more short term until we've reached a comfort zone, because when the patient is more comfortable, we're going to get better holistic results going forward. Until we can reach that plateau, holistic therapies don't work as quickly. So if we have a fire, often it's difficult to get that fire calmed down with holistic treatments because they work on rebalancing the body and getting the process under control again. So if you do find that your pet is uncomfortable, is that you need to reach out to us in a couple of ways. One is 847-541-4005. You can update us regularly by phone on the progress. Number two is grovepets@yahoo.com is a website that you can send questions and updates to on a regular basis, because it's really important that owners keep me up to date, because unfortunately the patients won't. They won't tell me what's going on. So you do have to reach out to me and keep in touch with me. So you probably got the base point readings, which looks like this, and then also the sensitivity list, which looks like this. And what's going to help me is, let's go on over, and this is a breakdown. Can you see that okay? All right. So first of all, we have symptoms. We have skin, which is flaky, itchy skin on the back, the feet with chew and lick, and then there's warts on the skin as well, which is related to the immune system. The traditional medicines that have been tried, ketoconazole, prednisone, tramadol, have been not real beneficial. We are on a hemp oil infusion. We should have started in damp heat skin herbals. And then atopic dermatitis is the more traditional working diagnosis. The middle line here looks more at the pattern, because the physical part, we typically have a pattern of heat, redness, and dampness. We do also have on the three other aspects is the mental, emotional, and spiritual energy that's affecting the physical. And so we do have to address those, especially over time. We want to make sure we have a well-healed pet, which is going to be the total body gets healed. The herbal treatment was the damp heat skin, so I'm curious, since we were having trouble getting that or giving that, are we still having trouble giving that? Because if we're not taking the pattern medication, then we're not going to see the results. So, and that's your responsibility to let me know how that's going. Also on the hemp oil, which is for rebalancing, we're going to rebalance the gallbladder, which it was at 58, and the range is 47 to 55. And also the lungs, which is at 61, and that's related to the skin, direct relationship. And then third is lymphatic control, which is the highest at 65. And when the lymphatic control function is off, then we have the immune system, immune-mediated inflammation. So that's where the rubber meets the road, if you will, because that's why we're not getting better, because it's in the system. It's not just on the surface. So when we see anything physical here, it's going to be on the surface of the body. And we're unfortunately going to see how it affects these other aspects. So the hemp oil is going to rebalance, but it's going to take 3 months. And 3 months of time, if they're comfortable, is not as long, and it does rebalance them. But in the meantime, if we're having other symptoms, we want to make sure we're addressing those. The other thing is food sensitivities, and it's broken down by the file food, which is the subfile additives, and then we break into further subfiles of red, yellow dye. These are typically in treats, so you want to watch for any treats that are given. Lecithin is used in a lot of healthy dog foods for neural health. And then also xanthan gum, which is made from carbohydrates in corn, wheat, dairy, and soy. We're seeing an increased use in the future because it's used with gluten-free products. And so gluten-free is becoming kind of the buzzword in diets. So we got to watch xanthan gum because it is a thickener, it's a preservative, an additive. And so so we want to check any treats or dog foods to make sure that we're doing, we don't see any of that in there. Because these are sensitivities. If they're not exposed to it, then there's no reaction. This is different than an allergy, which we didn't see allergies on the test results. An allergen is incorporated into the system and continues to react whether we're exposed to these products or not. So fortunately, we had a very short list, but it's interesting, as we pan back out here, it's interesting to note that chronic skin disease is not always allergies. It's really important because the 2 allergy points were balanced. So that means we don't have an allergy. We could have sensitivities, but we also have lymphatic control, which it can act very much like an allergy. And is that atopic dermatitis when we're dealing with genetic issues related to the skin? It's very possible because it helps us to quantify what's the exact cause. So to summarize the treatment plan, I'm going to set up, can you see that okay? First of all, the symptoms, I need an update as far as comfort zone. But if we need greater comfort, I'm going to refer to specialists to look at 2 products, Apoquel or the canine atopic dermatitis injection. These can help when the antibiotics, prednisone or tramadol is not. So that's a consideration to get the more severe symptoms under control. If they're manageable, then we can do it with herbs. Number 2 is damp heat skin. That's what we prescribe, so make sure if you're able to give that. If not, please let me know. Last email was not apparent whether you were able to give that or not. And then third, we got the balancing, which is going to take 3 months. That's hemp oil, 5 drops every day. If we're giving that, and that's going to help to rebalance, put this more into remission and restore health. And that's the point of well-heeled pet, is that we get them well-healed. Until they're balanced, they're not going to get better up here. So we want to control this until the body's able to balance it out. So to summarize, if you have any questions, growpets@yahoo.com, phone number 847-541-4005. Again, I'm Dr. Carlson. Please review the video and ask a lot of questions because communication and actually participation is expected in order to get them well. Thanks so much.